Let's talk now about naturopathic physicians. They're going to be at the Illinois State House today talking about the need for licensure in their industry. And joining us right now is Dr. Sean Hines with the Illinois Association of Naturopathic Physicians. Doctor, thanks for taking time with us this morning. How you doing?
Good morning, everyone. Yes, I'm Dr. Sean Hines. I'm a naturopathic doctor, an Air Force veteran, and I'm the president of the Illinois Association of Naturopathic Physicians.
So when people hear naturopathic, nature seems to be kind of, the ground word there. What is naturopathic medicine, and what are you guys looking for from the State House?
So we are a profession. Naturopathic medicine is a profession that combines the wisdom of nature and the rigors of modern science. We are actually trained as primary care providers who diagnose, treat, and manage chronic and acute patient cases. We focus on whole patient wellness, body, mind, and spirit, while we address the underlying cause of what's going on with the patient's condition.
So a little bit of a different kind of approach of what we see, the traditional Western medicine. Does this fit in that scope, or does it kind of, break out and think more outside the box?
We definitely think outside the box. When a patient visits us, a consult can take anywhere from an hour to 2 hours long. We really dive into what's going on with the patient, and we look at what's determining their health. So it could be, usually a lot of different things: sleep, diet, movement, toxicities, all kinds of things that can be determining stress levels. So we kind of take a whole person approach and really work on a foundational level to heal people.
We're talking with Dr. Sean Hines. She is with the Illinois Association of Naturopathic Physicians. So you guys are looking for House Bill 3721 to pass, and that would create some state licensure for naturopathic physicians. Talk about why you're looking for licensure.
Sure. We're actually licensed in almost half of the United States. So we want to bring licensure to Illinois. We actually have a naturopathic medical school right in Illinois, and all the graduates are having to leave to go to licensed states. So there are several reasons why we want to get licensed here. One of them is we want to bring healthcare choice to the residents of Illinois. We're experts in evidence-based natural and preventative medicine that focuses on the whole person. And Illinois residents should have the choice to choose this healthcare if they want to. We're not for everybody, but we are for a lot of people. Another reason for licensure is safety. Without licensure, anyone in Illinois can actually call themselves a naturopathic doctor. We have a complete medical education. We have to finish our prerequisites undergrad for medical school. Then we go to a 4-year doctoral program. After that, we have to complete board exams for licensure. So it's, total probably about 8 years minimum of schooling to be a naturopathic doctor. So that's one reason, the safety, so that people that know that if they're going to a naturopathic doctor, they're going to one that's properly medically trained. We found in states that we're licensed in, there's a confidence in naturopathic physicians for some people. Sometimes holistic-minded people can come from generations of people that are wanting natural care. So these people feel more comfortable and confident seeing a naturopathic provider. And some people are new to it and they want to go too. And what we found is that, we treat with many tools in our toolbox. So sometimes it could be a botanical medicine. Sometimes it could be a nutraceutical, changes in diet, all kinds of things. And sometimes that we actually do prescribe medications in several states. And sometimes we do have to prescribe a medication. So some of those people that are very holistic minded, their MD could tell them to take a medication and then they don't because they don't want to. And then they come to us. We do a full evaluation. we kind of look at what would be the best for them. And sometimes it could be an herbal, sometimes it could be a nutraceutical, but sometimes it is a pharmaceutical. And us telling them that makes them want to take it. They feel comfortable taking it. They feel empowered, and so it's kind of a safety thing sometimes. If somebody really needs to be on a medication, they'll take it if we tell them to. There's also another reason for licensure is there's a huge physician shortage that was just, it really increased with the pandemic, and every single county in Illinois has a physician shortage, a primary care physician shortage. And naturopathic physicians, we can be a part of that solution. We're not going to be all of the solution, but we can definitely be part of that solution. Another reason to license us, we tend to cut healthcare costs. We found that naturopathic doctors can reduce the cost of treating chronic and stress-related illness by up to 40% and cut costs of specialist utilization by 30%. So there's definitely a healthcare cost savings when working with naturopathic physicians. And then another reason is, like I said earlier, we actually have a school right here in Illinois, in Lombard, Illinois. It's called National University of Health Sciences, and they are, a lot of the graduates are moving out of state since 2006. They've all been moving out of state to move to licensed states, and let's keep people here and let's bring people back home, because I know for sure that a lot of the people that are living in licensed states that are from Illinois, they want to come back home.
Naturopathic medicine, you've got physicians that are going to be at the State House today to advocate for passage of House Bill 3721, which would allow for licensure and provide the scope of this industry for the state of Illinois. Dr. Shawn Hines with us. Just here finally, what's your message to lawmakers today that likely you're going to be running into all over the Capitol?
I just asked to support licensure for naturopathic physicians in the state. We are a choice in healthcare, and a lot of people want this choice. Your constituents, and we're not trying to, have people choose between conventional medicine or us. We worked together with medical doctors, other licensed providers all over the U.S. We work in hospitals, clinics, research institutions, universities. We're very collaborative. So yeah, we would be really excited to be able to work in Illinois.
And one last question: insurance, is this something that is covered by insurance?
Yes, in licensed states, we are covered by insurance.
And would this also, if you do become licensed in Illinois, insurance could help cover as well and provide that avenue for those who are seeking treatment?
Yes.
All right. Well, I appreciate your time. Thanks for coming in, Dr. Shawn Hines. She is with the Illinois Association of Naturopathic Physicians, asking for the passage of House Bill 3721 to license these physicians in the state of Illinois. A whole host of reasons. Greatly appreciate you taking the time with us. And be safe out there, all right?
Thank you.
It is Springfield's Morning News on 92.7 WMAY, Springfield's News.